The main reasons that patients should leave their healthcare provider ultimately comes down to how you feel that you are being taken care of. You may feel that you're not being listened to. You may feel that you're not being treated medically appropriately, emotionally appropriately, or respected, and that you're not being kept in the loop of your health care so that you can make decisions for yourself. Ultimately, the reason that a patient should seek other medical advice is they just don't have a connection with who's taking care of them. And sometimes that changes. When patients are going through their stages in life, sometimes their needs change. And those changes in a patient's needs sometimes require seeing a different type of physician, or a physician with an outlook that's more commensurate with where they are in their life. Our practice tends to be very consistent. I tell patients we are who we are, and we're very consistent in what we do. If I express my philosophy in healthcare, then the patient knows what they're getting. My question is, what's their philosophy in healthcare? And if they're similar, then the relationship can start. If someone is looking to come into my practice, I strongly encourage them that if they have a disagreement with their previous physician, to speak to them directly, because I never want someone to leave a relationship that they may have had a misunderstanding on to come to our practice when they were happy in their previous practice until maybe a prescription was filled incorrectly, or one of the people in the office was having a bad day and the patient took it personally. I make it aware that our office, like any office, is not perfect. But as long as our intent is there, we can overcome any misunderstanding. I give patients a promise, and that is, I promise that we're going to make a mistake. I also promise that as soon as I know about it, it'll be fixed immediately. When I sense that someone in my practice is not getting enough out of their visit, I first look internally to see if I am not performing it the way that I should be and taking an interest. And I question the patient. How are things going? Are we communicating well with you? I should have an innate understanding of how the office is run, but that's not always apparent. Ultimately, if you feel that your physician doesn't have your best interest at heart, you should go elsewhere, because it will help both you and the physician move on. Sometimes personalities are different, communication is difficult, and that can't be ignored and should be respected.